Tune in Saturdays at 1 p.m. for the Your Body is Your Pharmacy radio show. Hear from the doctors that were among the first in the U.S. to merge the ancient wisdom of Ayurveda and natural medicines with the advances of modern medical science. Listen to pioneer doctors Virender Sodhi, Shailender, and Anju Sodhi to keep up with some of the latest medical advances and learn from some of the true leaders of Ayurvedic medicines every Saturday from 1 to 2 p.m. with the Your Body is Your Pharmacy radio show on Desi 1250 AM, radio that listens to you. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information. Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic or call us at 425-453-8022. That's 425-453-8022.
Hello folks, this is Dr. Virender Sodhi and welcome to my show, Your Body is a Natural Pharmacy, where I teach you that you have everything in you to make yourself healthier and stay out of the disease process. What you have to do is you have to make your mindset, you have to think positive, and you have to eat healthier. You have to do exercise, you have to do meditation, stress reduction, yoga, stretching, and maybe take some supplement or even a medication sometimes. Yes, sometimes you need medication, but I'm not greatest fan of all these drugs, at least, because the studies and all those data available doesn't support that they help you. Basically, people die more when they are on the drugs. If you believe me, the CDC report says that the third cause of leading death is hospital errors and pharmaceutical drugs together. So you can see that which we think are preventing us are not preventing us. But certainly if you follow the simple laws of Ayurvedic medicine, where you have a positive attitude about thinking in balance, and you eat appropriately according to your constitution, you do appropriate exercise, yoga, breathing exercises, and have a good sleep, good laugh, good family time, you are going to live healthier and disease-free. There is a tons of data available from the people who has lived in hundreds of years plus around the world, like the Seventh-day Adventists in Costa Rica, those centenarians in Okinawa. If you look and analyze how these people they live, there is a very much commonalities in these generations. They have a hard-working attitude. They manual labor. They do eat healthy. What they produce, they have a good quality lifetime with their partners, with their spouses, with their family. Good structure, sports structure, and overall they just have the best time. And so basically, I think this is the secret of staying healthy. Today's topic is very interesting. As you all know, Tiger Woods, the legend golfer, was arrested last week under the influence of and was released later on, and it was found that he had been taking prescription drugs for pain. Unfortunately, he had many surgeries on his back and knees and whatnot. I think, as far as I have read, is around 4 surgeries on the back and some surgeries on the knees. And this guy has been given different prescription medicine, and one of them was a codeine, which is a narcotic, and he was also taking some other different 4 at different times prescription drugs for pain and also for sleep. And the combination of these drugs can be very disastrous. So a lot of people out there, are using a lot of these painkillers, especially narcotics, and they're also on drugs like benzodiazepines for anxiety, or they are on sleep pills like Ambien, Lunesta, or barbiturates. The combinations of these things can be very, very fatal, and it causes a lot of problem. And so today's actually I'm focusing mainly on narcotics, or which is also called opioids, because opioids derivative, which comes from opium, the poppy flower, the main two drug which has been used since the antiquity is morphine, which was the medicine comes out of the poppy flower, and then the codeine, which was a natural stuff, and then since then there is a lot of synthetic analogs has been made, hydromorphones and hydrocodone, and name there are so many of them. Those drugs which is available and very freely prescribed, and I'm going to talk about these things because there is a lot of social issues and health issues and the societal issues with the addiction and the abuse of these opioid drugs. It is estimated that around 26.4 million to 36 million people abuse opioids worldwide. So you can see the trouble is very rampant and huge, and all over the world. And that there is estimate that around 2.1 million people here in America suffering from substance abuse, means they are abusing it, and there is around 500,000 people which are addicted to heroin, which is also a derivative of the opioids. So you can see that this is a very serious topic, and even legend like Tiger Woods got involved into that one, and although it doesn't look like he was kind of abusing it, but he may be combining it in a different way, which he should not, and cause the problem for him. And of course, there are lots of accidents. The number of accidents has increased drastically under the influence of the drugs, a lot more than the alcohol. I think according to one survey, which I was reading, there was a 37% deaths were related to within the crashes related to alcohol, and there was a 48% related to the drugs, which is your opioids and the benzodiazepines and antidepressants and marijuana and all those combination of these drugs. And a lot of people are doing combination of this, and they have a joint here and there, and then have a whiskey glass, and then they pop in because they're not sleeping, popping in a benzodiazepine or Lunesta or Ambien, and then they have a pain on top of it. They're popping in another painkiller as benign as ibuprofen or as bad as opioid, and all these combinations are causing a horrendous side effects to these people. So I think there is an issue is very complex, and I not no authority to solve it in one day, but I'm trying to do an effort here to educate my listeners and at least myself too, because I also learned some stuff today, which was when you prepare for this kind of stuff, you end up reading a lot of literature and you learn something, and which is I like that. So why one question comes in, why we have the problem with narcotics? Basically the reason is, one thing is there has been a extreme increase, drastic increase in the number of prescriptions written by the doctors. So one of the part of the problem is, doctor, I remember several years ago, I was working at my home and I cut my finger working on a hacksaw, and my finger was cut. And so my wife was kind of screaming at the top of voice, looking at the blood flowing out of my finger, as usual, any spousal reaction. And so I did the first aid bandage, but my finger was kind of split into two. So I was taken to the emergency department, and where they put a stitch on. And the doctor, the emergency doctor, prescribed me Vicodin. And I was not willing to take it, but the pain was kind of, I've never taken, by the way, these kind of pill in my lifetime. So But somehow the pain was good, and I also got this. Okay, let's I'm gonna take it. I took one pill, and oh my God, the side effects of that was so horrendous. I could not sleep for 3 days. I had a, I was like a zombie. I was walking like a kind of a robot, and I have no uh, effect. My gestures were crazily, and I was have to really focus on talking and making a conversation. And I said, "Wow, one pill did it to me." And maybe I am not used to this kind of medication, but I was so scared to use it again ever. And I have since then I've never used any painkiller, and this is I think this must be around 20 years ago. And but I have injured my back again. I have injured my knee many times again, but I have not taken any painkiller because my reaction to that one pill was such a horrific. And thanks to my natural medicine, I have spondylolisthesis, which is a broken vertebra on my back. I have a torn ligament in my back. I have a torn cartilage in my knee, and I'm a little 60 years old, 5-year-old kid when it comes to the jumping on the logs or on running on this beach or climbing trees. So all those things comes with its own side effects. And I'm also a avid hiker and a gardener. So all those things, when the gardening season, in Washington State, as you know, it's not all year round. But when it comes, you end up working 8 to 10 hours. And sometimes I still think that I'm 20 years old and I may be lifting more weight than I should be. And that causes its own problem. But thanks to my natural remedies, I've been able to help that process and without getting any side effects. So you can see that the number of prescription has increased drastically. So I think the one is doctors to blame. But I will not blame doctors only 100% because there is another part of the story. It is also the pharmaceutical drugs which are putting ad in front of you. If you have this pain, talk to your doctor, you got this pill. And your pain will be a history. Yes, it does stop your pain for momentarily, for the time being. Does it fix the pain? No, it does not fix the pain. And so what will happen is, you go on taking one pill, then 2 pill, 3 pill, 4 pill, and by the time you kind of addicted to it. And the sad story about the opioids are that you can get addicted as soon as 3 days. Folks, 3 days. It only takes 3 days for you to get addicted on these opioids. So you can see that there is a huge potential of getting addicted to the opioids. And there are 3 major drug abuse categories, and one of them is opioids. Another one, the stimulants like Ritalin and your Concerta or Dexedrine. Those all which are given for ADHD and sometimes for autistic kids. Type of stuff, people who has a focus issues. The other one is benzodiazepines, which is your Valium and all those Xanax and Halcion. Barbiturates like phenobarbitone, and then the non-benzodiazepines like Ambien, which was considered when it came. I remember, I think it just came maybe 15 or 20 years ago. I don't know the exact date, but it is in front of me when the drug came. It was considered, oh my God, such a safe drug. For sleep now, you can have, just to find out that you have issues with that when it has a dependency. Same thing, there is a drug called Lunesta and Sonata. Those are very similar kind of drugs and has the abuse potential. So I think there is a doctors who are writing it too much. There is the pharmaceuticals which are putting the ad out there for people. Say, okay, if you have a pain, go to the doctor. Your doctor should write your prescription, and you have the right to get that prescription pill without looking at the consequences which you are going to get out of those painkillers. This problem is so bad right now that the death due to the overdose of the opioids has quadrupled in the last 20 years. There has been 4 times more deaths because of the opioid prescription and the street ones too increased. And your hydrocodone, like a Vicodin and Percocet, which is oxycodone. These drugs have been the percentage. This is interesting. Listen to this one. In 1991, the prescription for the hydrocodone and oxycodone was 76 million. So 1991, which is just yesterday, how many years? Around 25 years ago, if mathematics is right. Yeah, close to that, 26 years. So 26 years ago, there was a 76 million prescriptions were written for these two drugs, hydrocodone and oxycodone. And by the 2013, 207 million prescriptions were written. So you can see how many fold. It's almost threefold increase in the prescription. Do you think that the American population has increased threefold since 1991 to 2013? That would be like a China or India otherwise. So I don't think so. So you can see that these drugs have been certainly been overprescribed, and there is a, I don't know what is the reason for that, and it is a dangerous drugs category, and we need to be very, very, very careful. And the addictive phenomena is so real and so quick, as soon as 3 days, that we have to stay out of it as much as possible. By the way, if you have any questions, you can call me at 844-301-1250. Again, the number is 844-301-1250. And some of my patients has already text me some questions. There's lots of questions have been sent by text. But I will try to answer them, as I go along. I think a lot of those questions I'm covering anyway. But if you have still any question, you can certainly call me back at 844-301-1250. So continuing the discussion on the narcotics or opioid drugs, the one of the another, why people get addicted to these opioids? What is the reason? What is the science behind it? Why is so addictive? The reason is when people take it, it actually increases your dopamine levels, and that gives you high. And that's momentarily. It does not last forever. Like heroin has only, I think, I don't know the half-life, I don't remember it, but it's very short. It's like 30 minutes to something like that. So yeah, for 30 minutes or so, or maybe 1 hour, if you take excessive time, you feel like high, but you look that high that you want that high again, and you go on doing that stuff again and again to get to the next high, and it never happens. And there is because of that, people are just, once they're not getting a prescription from the doctor, they're getting in the street. If they're not getting a street drug, then they're going into heroin. And there has been statistical data available that people who are not given or have started on these narcotics or opioids, they are going to heroin. And heroin is actually, the one of the worst one. So basically, you can see that, we are creating a lot more problem. And there is a lot more than 100 million people which suffer chronic pain in USA. And the opioid therapy is kind of the main hallmark of pain management. So say around 38 million people has non-cancer back pain, and around 17 million has osteoarthritis. And even these people are given the narcotics too. And most of them, they can be managed by many other methods. And we will talk about those methods later here. But giving these prescription drugs for these kind of symptoms, I think is a little over too much. I remember a few months ago, I got a patient, and he was just begging for me to write the prescription for Vicodin. And I checked the chart notes, and he has been, here in our clinic around 1 year ago, and he was again wanted to have that prescription drug. And when we wrote the prescription, we got a note from the pharmacy that he has gone to 10 other doctors to get the same prescription. So these people who are addicted, they are trying to collect prescription for as much as doctors they can, and get get these drugs any way they can get. So now you know why people get addicted, because it increases your dopamine levels, and the dopamine levels are very addictive. And when we have that, we have a problem. So what are the problems with this opioids? What is going on with this, the whole story of this one? Do you know that there is around $484 billion cost of these opioids for Americans. And this is the healthcare, lost wages, car accidents, criminal justice system cost. So you can say it's very expensive, very, very expensive. And I think this is a issue which we have to deal with it. Yes, no doubt it's a wonderful medicine for controlling pain, and for cancer patient is maybe the best option they have available for that. But a lot of other, it can be managed. Even cancer pain can be managed, with a lot of non-opioid approach too, and I will talk about that a little later here. So 50% of the crimes are done people who are on these opioid drugs. So you can say, wow, it has a huge impact on the society. And either they are arrested on the violent crimes like homicide or assault. They all are under the influence of opiate. 50%, guys, this is a lot. There is also reports that people who abuse opioids, they have been sexually abused as a children too. So there is some huge mental and emotional component about these people who get addicted to these drugs, and which maybe they need more counseling or rehab, because mind has a very powerful identity on pain. And so we needed to certainly, look at it many different ways so that we don't get dependent on these drugs. Again, it comes to finally to us, how we want to deal with a pain management, given, because we all, pain is the one of the most common reason why any would go to a doctor, because to get the relief from the pain. And if the doctor is writing a opioid prescription, I think this is in my personal opinion, is that doctor needs to think twice or three times before he write a prescription. So he need to look at the severity of the pain and why he needs to write down. And always, my formula is always start the lowest level, where you can go the least minimal side effect drug, and then if it does not work, go to next level, then go to next level. And I don't go into the magic bullet one first pen, because that is not the best approach in my personal opinion. So what are the side effects, of these opioids? So one of the things is, people get high and they feel euphoric for momentarily. Like I said already, the heroin can be around 15 to 30 minutes, and morphine actually can last up to 4 to 6 hours. And a lot of people are addicted to morphine too. And then, it does give you pain relief. There's no doubt about it. But you see, every 4 to 6 hours, if you're on a morphine, you're going to have to take that. And then you get a little euphoric, and then your cells are getting so addicted to it, and you want it again and again. It also causes drowsiness, so people use it for sedation. The side effects that is, people who has taken these drugs, they will tell you they get drowsy, lethargic, they have a paranoia, they can have a respiratory depression. One of the major side effects of these opioids are respiratory depression. Like if you have a head injury, the medical biggest no is don't give any opioids or morphine drugs, because that can suppress your brain center further, and you can die because of the respiratory failure. It also causes nausea. So you can see that these are some short-term effect of these one, but the long-term effect, like a nausea, abdominal distension and bloating, constipation, very major component is the GI disturbances with opioid. Anybody who has taken opioids anytime, they will tell you they cannot go to the bathroom. They get very, very badly constipated. And then the liver damage is another one, because any drug which is given to the system, most of them has to be processed by the liver, and it's toxic. So when you're passing a toxic drug to the liver, and the poor liver is there to help you to detoxify, so what it end up sacrificing itself, because that drug is so toxic for you. It also causes brain damage, because the lower amount of oxygen goes to your brain, and due to respiratory depression, and you can have a brain damage because of that. And of course, the dependence and all those kind of stuff too. So what is the option out there for us? I think we need to be educated. Very, very important for us to educate ourselves that why we need to be on opioids. Opioids are a good drug, but should be very short and sweet. There are exceptions, like people who has a pain which is not controlled by anything. They may get their life back with the taking it, but of course they will be get addicted too. Then one of those I think would be cancer pain, although there are other options available too. So I encourage my patient to use other options which are less addictive than the opioids. Outreach, just talk to these people, talk to the doctor. One of the another interesting thing is, a lot of times doctors are so busy, as you know how the systems are. Most of the doctors doesn't have more than 5 minutes or 10 minutes spending with the patient. So he's listening to him, he's talking about the symptoms and disease, he's trying to diagnose, he's trying to find out what's going on wrong with that person or that particular subject there, and trying to make a chart notes to fulfill the requirement for the insurance company. It's like a huge lot of work. Because I know, being a physician myself, my work ends up at 10 o'clock every night on my patient days, because I'm still finishing up the chart note, and I don't get paid for that at all, because that's not what I get paid for. And then at the same time, you're trying to explain him that how to take a medication, and he may forget that, or the patient may not tell him that he's taking already a Ambien or a benzodiazepine, or he's on a antidepressant drug. So now the responsibility lies on the patient, that he should tell everything to the doctor. And many times the doctors they have a pharmacology training, yes, but they don't have extensive pharmacology training. Most of the doctors are taught 3 months of pharmacology, and this is true, unless you're a pharmacologist. The pharmacist has, on the other hand, 4 years of training on pharmacology. So whenever you go to pick up your prescription, talk to your pharmacist. Says, okay, I'm on this drugs. Do you see any problem with the interference or interactions, or it will make me more sick with it? So basically, I think, again, anytime you pop in a pill, you should be very, very responsible for popping in a pill, because you can have consequences with it, and especially these kind of drugs when you're putting in your mouth, or these all amphetamines or opioids or benzodiazepines or barbiturates, which has a high potential of abuse and toxicity. So one of the thing is, which we talked about, that pain is the main reason why people go to a doctor. So I'm going to talk about a little bit the physiology of a pain, which is very complex and very difficult. We know something about it. We don't know everything about it, and why we get pain. And pain stimuli can be different for different people. I can give you examples after examples. Like, somebody can have this completely chopped head, and he will have no pain. He will have a pain, but he does not depict the pain. And other people will just have a small blister on his foot, and he will be yelling and screaming with the pain. So there is a huge variation in the perception of a pain and how the pain is depicted in that particular person. So after a short break, we'll talk about what is pain, and what is the mental emotion component of the pain, and then what yoga, meditation, breathing, Tai Chi, acupuncture, what herbs you can take if you have to take narcotic to cut down the side effects of it and not to get addictive, and what are the natural anti-inflammatory available, analgesics available. So we'll continue our discussion after the short break here.
If you or someone you know is diagnosed with cancer and is interested in adjunctive holistic approach, please come and meet our doctors at Ayurvedic and Naturopathic Medical Clinic, or call us at 425-453-8022. That's 425-453-8022. Are you looking for quality Ayurvedic and naturopathic treatments for your chronic issues? We offer a holistic, wholesome approach to living with chronic diseases. Call us at 425-453-8022 for more information. If you're suffering with diabetes, heart disease, hormonal issues, digestive issues, and other chronic health issues, we offer comprehensive Ayurvedic and naturopathic treatments to reverse your diseases. Call us at 425-453-8022 for more information. Panchkarma detox treatments are a great way to utilize natural healing mechanisms of the body. Our clinic in Bellevue, Washington offers over 36 years experience in Ayurvedic treatment. Call us for more information about our Panchkarma treatments at 425-453-8022. That's 425-453-8022.
Welcome back to the discussion of the opioids or narcotics in pain management and the side effects of it, and what are the natural ways for us to help not to get addicted if we are put on the prescription drugs for pain management, and what you can do to help your whole body in case you get addicted to it. So we'll try to cover that too, but it's a huge topic, and I may not be able to cover everything. So what is pain? Pain actually is a very interesting concept. As I said earlier, I remember have a relative, and she will deliver a baby without even making a noise. And as you know, the labor pains are very kind of intense, and she will have even no facial grimaces that she's in pain. But to some person, the pain can be such a horrifying. Even a small prick in the foot or in your blister on your hand can throw it to the roof. So there is no mechanistic way of measuring the pain. In medicine, we use two terms called nociception and pain. So nociception refer to the peripheral and central nervous system processing of the information, which is to the internal and external environment, and which is activated by, there are special kind of receptors, which is called nociceptors, which is typically all over your body. So they are spread all over the body. And whenever we get a kind of a obnoxious stimuli like your heat, cold, pricking, cutting, tissue injury, so what that does, that activate these nociceptors, which are present in the peripheral structure. And that information is transmitted to the spinal cord. And then that information goes to the brainstem, and ultimately that information goes to the cerebral cortex. So you can see this is a complex issue. So the nociception is the information going from your body to the cerebral cortex. And cerebral cortex is where we have the perception of the pain is generated. So the pain is a product of higher brain center processing, whereas the nociception can occur in absence of pain. So, you can still collect. So people who are like a paralytic, they still have the nociceptions, but there's no pain because they can't feel it, because that part of the body is not functioning. So there are two different things, but you can now understand what is the nociception and pain. So very interesting phenomena here, and there is a lot of studies done on these mechanisms. There is a different kind of fibers in the spinal cord which takes different kind of messages. Some are short acting, some are long acting. I'm not going to bore you to the death with the anatomy and physiology, because that may not help you to understand what's going on. But what I'm trying to say, this is the complex issue. It's not very, very simple, straightforward issue. But what happens is all the information get processed in our brain finally, and then we are creating a kind of a pathway for pain. And sometimes this is a cyclic, you go on triggering one after another, and that it creates a regular pathway for the pain. And a lot of people who has chronic pain has that pathway. We all have suffered a acute pain when we got hit by something, playing basketball or football, or falling from a bike, or getting injured by hitting your head. And that, you sends you message there, and you say, there's a pain, and you're trying to get some attention. Basically, pain is there to get your attention. But when you numb the pain, the body is also you're not helping the whole body, because numbing the pain does not get the right message to the whole body. So this is another interesting concept. I think a lot of times we just want to numb people, giving all the drugs we can do to cut down the pain. But pain can be very protective. For example, in animals, especially in horses or big animals like cows or horses, if they have a leg pain and if you give them a painkiller, that's the end of their life story, because they get paralyzed, because they don't have that message going to the brain, so they cannot protect it. So there's a complex. I'm not saying this is the only way, but there are many other ways which you can have that pain managed, and by blocking pain 100% sometimes may not be help our body to heal properly. And it's also under a lot of influence from the mind. Anxiety play a big role, fear plays a big role, stress plays a big role. We all have seen that when we are under stress, we have more neck pain, back pain, low back pain, even headaches, even arm pain. There is a complex issue. It's not like a simple answer. That's why I think there is a reason why we are not able to fix it properly, because we don't know what is the reason why people are getting pain. There can be inflammation, and inflammation can be due to many reasons. It can be digestive issue. It can be a issue because you have offending stuff. It can be bacteria, can be fungus, can be virus, can be a chemical. For example, heavy metals, or a pesticide, or insecticide, or a foreign object. So there are so many ways your body can create that pain mechanism in you. And so basically what we have to do is, if you can try to look at what is the cause of it. So mentally and emotionally is very important, as I said earlier. A lot of time, like people who are addicted to opiate, they have a childhood abuse, a lot of childhood abuse. So you can see that these people has been abused as a young kid, and then they have developed the problems with it later on for addiction to the opiates. So I think what we have to do is have to look at what is the cause of my pain. What is the reason why I'm going? Is it acute trauma? Usually lasts for a few weeks and this over. Your broken bone takes around a couple of weeks and to 6 weeks, and you're over with it. So every tissue heals, but we have to properly follow the guidelines to heal that tissue. For example, mucous membranes in your mouth, you drink a hot tea and you burn your face. Sorry, your tongue, and it get healed very quickly. The next day you even forget about it. You got a cut on your hand. 7 days later you even forget about it. There was a cut on that one. If you have broken bone, takes around 6 weeks. Similarly, liver takes 6 weeks. The nervous system can heal too, by the way, but take up to 1 year to heal. So that's maybe the one reason we develop that chronic pathways of pain, because the body is constantly trying to get attention, and we are suppressing it and not allowing it to heal. This is my concept, by the way. I'm not trying to put the science into it. So what is there for you guys to do when you got, if you got a prescription for painkiller? So like, for example, if you're suffering with a cancer pain, which is a horrifying disease to begin with, and a lot of people who has a cancer pain, the pain is not controlled. So there is not much options, but there is also acupuncture has shown to decrease the pain of cancer patients. Therapeutic touch, like just touching people. I think we got so touch phobic in our culture that we get scared, touching people, and that also has an amazing effect on calming down. Like, whenever you're scared or fearful and somebody gives you a hug, and especially if you're close to somebody, your spouse or your mother, your father, your brother, your sister, or even your good friend, when he or she gives you a hug, you get calmed down. Your system started to feel better. You calm down the anxiety and the stress, and you may do a cry or you may talk about something, but after some time you feel very calm, very, very, balanced. And so the touch is very important too. The meditation is a very healing mechanism. Meditation has a huge impact on the pain management. There's a tons of data available. You can direct your body to cut down the pain stimuli by going in meditation. There is a Tai Chi, there are breathing exercises which you can do. The breathing exercise, simple, one of the very easy and good one, which I call as a alternate nostril breathing, or in Sanskrit it's called Anulom Vilom. So you're breathing to the one side of the nose and then you're letting it to the other side of the nose. and then breathe through the other side of the nostril, and then let it out through the other side. So that's why it's called alternate nostril breathing. And anybody have given this alternate nostril breathing and who has done it 10 to 15 minutes, this tremendous amount of improvement in their pain management. So these are, very simple, non-toxic. You can never go wrong by breathing or by doing Tai Chi or meditation. Even acupuncture is so benign. I personally got acupuncture recently because of the injuries I had sustained on my back and due to the car accident. And I'm very happy to report that it made a big difference. I was kind of getting numb and tingling sensation. It made a huge difference in me. So I think these options are out there. Physical therapy, very important aspect of healing. We can heal by going to the physical therapy, and sometimes you have to find a good one. It's not not all those people out there are good ones, but get a referral from your doctor or a person who has gone through that program and has received that treatment, and talk to them, see how they feel. Physical therapy is a really wonderful way of healing and retraining your muscles and your ligaments and your even your posture. A lot of times, I see patients with the back pain, and they don't know how to sit properly. They are either hunched over or they are sitting too slouchy. They're not putting their body together. And when you don't do that, the body's natural mechanisms are that you want to hang balanced. Like if you draw a plumb line in the center of your head, and if these two sides has to be equally good, that is the balance. But this is interesting that once you go through your own pain mechanism, you understand a lot of stuff about you. A few years ago, I was in a car accident. I was hit head on by a car, and my right side of the foot got injured and my back got injured. And so what happened, I think I was protecting my right side because it was injured, and my left side of the knee was in pain because I was overusing it. And what I noticed that the way I was walking, I was trying to protect one side and putting less weight on the one side, and the other knee was getting too much excessive weight. So when I realized and learned it, I just shifted my weight and tried to consciously all the time worked on that one. And after some time, my body will start to adapt it, because this becomes habitual for us. It takes regularly, again and again you're walking same way, and you re-injuring again and again, and you're creating the pain mechanism for you, and deterioration, arthritis on top of it. So I think learning to realign yourself. So yoga is an amazing tool for that. And you go to a nice yoga teacher, and we also give yoga training here, by the way. On June 17th, we are having a yoga and Ayurvedic day, 11 to 4 o'clock. And please come up with your families and friends. There will be food. There will be lectures about yoga. There will be lectures about the food, about the daily routines, the main focus is that how we can be disease free. They're not to sell anything, but basically how you can create a balance in your daily life so that don't have diseases. So we'll talk about some yoga. We'll perform some yoga and breathing exercise. My wife Rekha Sodhi is actually cooking for the event. There'll be some very nice snacks and food available. And she's also talking about how to cook on the go, and because we all are busy here, and cook healthier, and so don't have to spend hours and hours on cooking. So we'll have a demonstration on that one. And I'm talking about the benefits of yoga. Dr. Virender and Dr. Anju have their topics. I think Dr. Virender is talking about the daily routines, and Dr. Anju is talking about, I forgot what she's talking about right now, but we will be talking about all the daily stuff what you need to do, about the yoga, about the food, and how we can be healthier and create a health circle around it in our head. So yoga is very important for all of us. And it does not matter how busy you are. Even if you do a 5 minutes of yoga a day, you'll see a huge benefit. I have, injured my back so many times. I was a weightlifter and power lifter in my college time, and I've injured my back very nicely with that one. And as you're young and a little stupid, you want to lift as much as you can without understanding that will have consequences. I think Tiger Woods is another. He's a legend in golfer, but has so many surgeries on his back and the knees already. So these all comes with the positive and negative impact of it. And I have done my share to my back. And so I have a spondylolisthesis at L5 and S1. So spondylolisthesis is where the vertebra is broken, and it can act out, even doing normal activity. But what I've done since I've started to do yoga for many years and try to keep my core muscles healthier and do some weight training, gentle weight training, I will call it, with my own body weight and stretches, I have kept that pain off and not taking any pain medication for that. So which is really good. So I think there are options available for you to do yoga, even just 5 minutes. Breathing exercise is a really good tool too. And we talked about meditation. You can develop a routine. Okay, I need to do maybe 5 to 10 minutes of meditation, 5 to 10 minutes of breathing exercise, 5 to 10 minutes of yoga and walking, which is really good for everybody. And if you don't put these kind of effort into your body, you're not going to get pain relief, by the way. You will see, no matter how much in pain you are, even if you do a small walk, I don't care if you do 1 minute, 2 minute, 3 minute walk, but do it consciously and do repeat it many times. You'll see that your body is starting to recover slowly but steadily without the dependence on the drug. Because the drugs don't heal. You know that. Drugs are not going to heal you. They are going to make you more toxic over time. So, okay. So now if you are prescribed narcotics and, you have no choice, and that you've been given that and you don't want to be addicted to it. So what you can do? So one thing is, use it wisely. Don't overdo it. If the doctor said take 5 milligram, take only 5 milligram. If the doctor said take 10 milligram, take 10 milligram. And if you need to use more, talk to your doctor because he should be in the loop. If you're not putting the doctor in the loop, he is kind of blindfolded and he doesn't know what's going on with you. So I think a good conscious doctor will certainly make sure that you listen to what your body is telling you and how much you can use. Because not everybody can be using the same amount of doses. And we are so different. We all are different. Some of us can actually use, heavy doses of medication. Some of us can't use heavy doses. We just very light doses. It's all individualized. So talk to your doctor about that one. But if you are on a narcotic, and as I said earlier, that it takes only 3 days to get addicted. Many people will get addicted. But there are some good herbs available for you. And these herbs are very non-toxic, and that's why I'm giving you on the air. And one of them, my favorite, is ashwagandha. Ashwagandha itself has an anti-inflammatory effect, anti-pain effect, analgesic effect, has a steroid-like structure. So it is the steroids are very powerful anti-inflammatory, but does not have the side effects of a steroid. It also lowers your cortisols by 30%. So cortisols are inflammatory and zittery molecules, which make your body kind of a shake and it triggers the inflammation molecules in you. So it lowers that down. Also, it has a hormone balancing effect. So if you have a low testosterone or low estrogen or testosterone, which most of us have these days, hormones are very, powerful anti-inflammatory, anti-pain, and make you younger. So it balances your hormone. So now you can see that, you have all the positive. And why I want you to be on the ashwagandha, the animal studies have shown when the animals were put on morphine and were given ashwagandha along with the morphine, and when the ashwagandha was removed, not ashwagandha, morphine was removed from the animals, they did not have withdrawal effect. Hey, that is amazing. So out there, all those people who are on opiates, should be taking ashwagandha. One capsule, 500 milligram 3 times a day, or two capsules, depending upon the severity of the inflammation. And this is very non-toxic. That's why I can give you, with a lot of confidence. So ashwagandha, it can be come to your rescue. Another herb which is wonderful, again, as good as ashwagandha, is called Bacopa monieri or Bacopa. Bacopa is a brain herb. It's in Ayurvedic medicine. We call them brain tonic, or medya mean brain tonics herbs. Similarly, when the animals were given morphine and they were given Bacopa, and when the morphine was withdrawn, the animals did not have withdrawal effects. So have anti-addictive effect again, guys. So now you got two herbs which has anti-addictive effect. I'm going to give you another one, third herb, which has anti-addictive effect. And this is called Mucuna pruriens. Mucuna is a bean, or same family as fava bean. And fava beans it increases your dopamine naturally. So, the pleasure hormone, make me feel good hormone. By the way, ashwagandha and Bacopa also increase your dopamine levels too. So that may be the reason how it's actually counteracting the side effects of the morphine or opiates, because it makes your dopamine naturally up, and it's not addictive as compared to those are addictive. So that is a interesting phenomena. So I've given ashwagandha and Bacopa to people who are on opiates, and when they took it off, they didn't have withdrawal effect. So I think, and these herbs are very safe, non-toxic, and you can use it. And if you have any more questions, you can call me or you can call our clinic. We'll be happy to help you. Now, what are the different herbs which you can use for inflammation? Because, one of the major cause of pain is inflammation. And it can be inflammation in any part of the body. It can be your intestine, can be in your bone, can be in your nervous system. Whenever there's inflammation, there are cytokines, which is inflammatory molecules triggering up that disturbs the natural balance of the nociception, and which causes the pain to trigger in. One of my favorite is turmeric. The turmeric is such a wonderful herb. Again, very non-toxic. At the maximum, you're going to get a diarrhea if you take excessive amount of it. And I have developed a product called co-curcumin, which is very powerful anti-inflammatory. And you can take 1 teaspoon of turmeric in your milk, or this co-curcumin, 1 teaspoon 3 times for different kind of inflammation in your body. Another herb which I use with a lot of success is ginger. Ginger is amazing anti-inflammatory and has been used for osteoarthritis, for back pain. Again, non-toxic. At the maximum, if you're using heavy doses of it, you may get a little heartburn, but it's good for the digestive system too. So ginger, turmeric, curcumin, black pepper, another common spice. You can do is you can mix half. Like I say, 50% black pepper, 50% ginger, and start using 1/4 teaspoon along with your medication, which you're using. So these herbs are very powerful anti-inflammatory and will also cut down the withdrawal effect of the drugs which you're on. Another favorite herb is cayenne pepper, which is also very powerful anti-inflammatory. It has a special compound called capsaicin in it. The capsaicin has a anti-inflammatory effect, and also it works on the nerve endings differently. So there are local applications of capsaicin, which is wonderfully good. But there is some side effects to it. And capsaicin is a kind of it burns it, and you feel a little hot with it. So basically, you feel that the nerve endings kind of getting little different kind of effect from it. And I've used it personally too. The only side effect which I saw when I use that when I take a shower, hot shower, when the water hit that area where I put that capsaicin on it, it burns. And be careful, not to use this capsaicin in your eyes and you're close to your mucous membrane. So looks like we are coming to an end here pretty soon. And I got the clue here that the music is on. So guys, if you're on opioids, be careful and do your yoga, meditation. And if you have to be on, take ashwagandha, bacopa, or mucuna. Take these herbs, turmeric, ginger, black pepper, even cayenne pepper, local applications can be helpful. And stay healthy out there. The life is for living, every second of it. And until next week, have a wonderful day.